through a disease they never knew they had. Life with HIV has dealt them many blows and hurdles that they have had to overcome to get to where they are. Take a look.
In the midst of what looks seemingly less is plenty. Though HIV has claimed many lives and subjected others to abject poverty, hope burns alive.
Here in Manyata, Kisumu, we are just about to meet two sisters living in this one-roomed house for the past 1 year. Not only are they living positively, but they were orphaned by this disease almost 10 years ago.
First, we meet the eldest of the sisters. We shall call her Claire. She prepares a sitting place on what is their bed, a flattened carton box, their one blanket serving as a cushion.
I was 15 years old in class 8. Yeah, that's when I knew my status.
Now at 19, the diagnosis then was hard-hitting.
The people who I was staying with told me that my parents died of that. So I was like, hey, mi siwezi kuwa nayo. Okay, nobody told me about her status. But she was always, alikuwa anakuwa tu msick kila wakati. But hakuna drug yenye alikuwa na take.
She passed on shortly afterwards. They lived with their maternal grandparents then, never knowing who their father or paternal relatives were. Life did not have any better news. She had to rise up to a mother's role, a role her younger sister, whom we shall call Sarah, knows all too well is the cord that binds them closer.
She was seeing like I was weak. So one day she decided and took me there for some testing. There I went, I was tested, and it was not my fault being born with it, so I had to concur with the results. Yeah, and accept it.
Sarah, now at 18 years of age, is nursing wounds she would have wished not to have to live with.
I blamed my parents for not telling and for not informing me. You know, when a parent tries to explain something or express something to you, at least you'll get to understand it. Why did this happen?
The two sisters, conflicted by their past, had to find strength to live. Luckily for them, they had a well-wisher who saw them complete their secondary education. Claire scored a C+, while Sarah managed a C plane despite strong negativity around them.
Walikuwa wana take, like example ya my mom, alinizaa kama ako form 2. Unaona? So hakuweza kumaliza shule. So they were taking that angle at me pia kwa to the same. And the same with my sister.
They proved many wrong. Tragedy, however, was still lurking close by. Their maternal grandparents passed on 1 year ago.
We had to, like, kujitegemea. We had to do something so that we are only two. Hatujui wase wako kina babangu.
A life that is tougher by the day, lacking in even the basics, food. This cup of tea at times is the only meal the two sisters have. Yet, their twice daily dose of ARVs demand a lot more than such tea if they are to live healthy, long lives.
Kuna some things tuna lack, but we usually don't lose hope. Tunajua tutapata. Kwa nataka nirudi shuleni ndata kole, I go nisome nini that, kwa peer educator nisome that kai naweza. And also for my sister hii pia nataka tu yani aendelee na kusoma.
Claire works as a peer educator with an NGO. Her 3,500 Kenya shilling monthly income pays 2,000 for their one-roomed house and leaves them another 1,500 to cling on. Their dreams are still grand.
I believe that whatever I'm doing will one day take me to the level that I want.
Nisaidi tu my younger people wenye wako na that myths and misconception about HIV.
Misconceptions that she and her sister learnt of the hard way, painfully so.
Someone accuses you of something that hukuwaifanya, hata mwenyewe haujui, unaona, na mtu anakuambia like only have sex, unprotected sex, then ukapata HIV. Wanakuwa hurt sana.
It's hurting and painful, but at a point also, I just feel free because I believe in myself. I believe I didn't do it. It's not my fault.
Learning to courageously face stigmatization and make lemonade with lemons thrown their way, Claire and Sarah's support for each other is unquestionable. Their current situation not extinguishing the hope they have for a better future. Dr. Mercy Korir for Health Digest, KTN News.
Quite a story there by Dr. Mercy Korir. Now, the Kenyan Asian community has today been recognized as the country's 44th tribe through a Gazette notice dated 21st July 2016.